Hello again. The final video today will be looking at a young seal pup with a laceration to the neck caused by a fishing net. Seals being injured by fishing line or discarded lost nets is quite a common occurrence in the British waters. They are often unable to remove the net themselves, and it then embeds in the skin, causing deep lacerations to the area. This is often the neck or a flipper. They must then be captured and have the net removed. This must only be done by professional organisations such as the British Divers Marine Life Rescue. Their staff are fully trained to handle seals as safely as possible. The case we're looking at is a recently weaned grey seal pup weighing around 45 kilograms. It was found on the beach entangled in a fishing net and was seen with a large laceration to the neck. It has been in the same location for at least a day and seemed very reluctant to move on. Advice for the members of the public if they find an entangled seal. If you find a seal, the advice is to call an animal rescue organisation. The BDMLR, the RSPCA, or a local rescue centre or veterinary surgery are the best places to call. You need to give information, give a location if that's possible, give the description of the seal, including a rough gauge on its size and its overall condition. If you can stay in the location until the seal is rescued, please do. If possible, stay near to the seal until it's rescued and try and stop it being disturbed by people and dogs. And finally, whatever you do, do not attempt to touch a seal or remove the net yourself, as this may cause further injury to the seal or you may get injured yourself. Only trained marine rescue personnel should capture a seal, as they can be aggressive and bite. The rescuer is trained to do this correctly. They will approach the seal from behind, using a towel to cover the head while straddling the seal and holding it with their knees, and firmly hold the neck with both hands close to the head. This technique can be seen in the picture above. Once restrained, it should be put into a crate and transported immediately to the nearest seal sanctuary or vets where a veterinary surgeon can assess it. An idea of the type of crate that will be used is in the picture here. Upon arrival, the vet will immediately administer emergency anesthesia to the seal. This is standard practice with all wildlife cases. This seal will probably be given an opioid such as butophorol at 0.2 milligrams per kilogram. This will be given intramuscularly. The seal weighs roughly around 45 kilograms, so will be given 9 milligrams. Then, once the seal is comfortable, the vet will perform a health check on the seal. During the health check, the vet will try to identify the species. This seal is a grey seal pup. Determine the approximate age of the seal. This is to see if it is maternally dependent. This one is a fully weaned pup. You can tell this by its coat as it has recently molted with a few tufts of baby fur still showing. Then they will assess the body condition. They are looking for it to be sort of rotund in shape. This seal is, it's looking quite healthy. Next, they check for dehydration. If the seal is dehydrated, the eyes will usually be crusty and sunken in. Next, they will be assessing the extent of the neck injury, looking for the depth of the injury and any sort of oozing and signs of infection. They'll look for pressure necrosis of the tissue, also checking for any damage to the bone or even the eyes. Next, the temperature will be checked, and they're looking for it to be around 36 to 38 degrees C. Next, they will administer fluid therapy. Because of the neck injury, the pup is likely to be dehydrated. On a pup this age, fluid will be administered orally with between 250 and 350 ml of rehydration solution given via a lubricated tube down the throat directly into the stomach. This will be given every 3 to 4 hours for as long as is needed. The seal then, if not already done, will be weighed, and this seal weighs again around 45 kilograms. If the seal is not already in one of these places, they will transport it to an appropriate care facility. The seal must be placed into isolation initially to avoid the possible spread of disease. They have to, again, ensure the seal is stabilised. The seal needs to be stable and sufficiently hydrated prior to any attempt to remove the netting, because if the net is removed before, it could cause a sudden surge of toxins and inflammatory markers to enter the seal system and may result in death. The vet will administer antibiotics, this usually being amoxicillin, and it's at a ratio of 7 milligrams per kilogram of body weight. For this seal, the dosage will be 315 milligrams and will be given intramuscularly via the lumbar muscle, that's into the back, every 24 hours, and 10 milligrams per kilogram will be given orally every 12 hours. For our seal, this would be 450 milligram dosage. Fluid therapy will continue to be given. Once stable, the netting can be removed and the wound flushed. With seals, the aim is always to release the seal back into the wild and in as short a time as possible. In order for this to happen, the seal will need post-operative treatment and care. This will include continued antibiotic treatment for as long as needed, daily salt baths to help clean and heal the wound, daily feeding to encourage growth and weight gain. The seal will be kept in a care facility until the wound is healed and any infection has gone. For the seal to be classed as fully rehabilitated, they must be able to dive and self-feed. When it comes to finally releasing the seal, the idea is to release the seal in the same coastline as it was found, preferably in the exact location. The release team will transport the seal in a crate and release a crate similar to the one shown in the picture before and release onto the beach in a quiet location and allow it to leave the crate and enter the water in its own time to minimize any stress to the animal. The prognosis is good for seals with a non-severe net entrapment injury. Seals are hardy animals and are able to survive injuries well, especially if they're receiving veterinary treatment. In conclusion, this YouTube channel has shown 3 different case studies: a dog, a cat, and a grey seal. It has shown the public how animals are treated and which equipment is used within the veterinary practice when treating their patients. Thank you for listening from the Amos Teak Veterinary TV team.